Hello, my name is Joshua Brown from the expert interview training company howtobecome.com, and in this presentation I'll share the essential tips for excelling in your nursing job interview. Whatever healthcare organisation you are applying for, these tips and the top scoring example answers will help you pass your interview at the first attempt. So let's jump straight into those quick and powerful tips. Nursing interview tip number 1 is to use what I call the 3-pillar preparation approach. Now, the 3 pillars of this approach are: number 1, research the facility. This is where you must understand the hospital or clinic's mission, their values, their culture, and the types of services that they offer. Make sure you familiarize yourself with their recent achievements or any awards that they have received. Pillar number 2 is to really understand the job role. Make sure you study that job description in depth and look at the specific duties that the job role entails. Know what the skills and experiences are that are essential for the job role. This will all be listed on that job description. That job description is your blueprint for success. So for example, if on the job description it lists they're seeking someone who has a patient-centered approach and has great communication abilities, then throughout your nursing interview answers, be sure to talk about those skills and give examples of where you've previously demonstrated them. And pillar number 3 is to practice common interview questions. So some common interview questions that I recommend you prepare for are: why did you choose nursing as a career? Can you describe a time when you had to handle a difficult patient? How do you manage stress on the job? And why do you want to work here? So let's take a look at a top scoring answer to the interview question: why did you choose nursing as a career? Here's my top scoring answer to help you. I chose nursing as a career because it combines my passion for helping others with my interest in science and healthcare. From a young age, I was drawn to the idea of making a positive impact on people's lives, and nursing allows me to do just that every day. The opportunity to provide compassionate care, support patients through challenging times, and continuously learn and grow in a dynamic field excites me. Nursing is not just a profession to me, it's a calling that aligns with my values of empathy, resilience, and dedication to improving the well-being of others. Wow, that's a great answer to that interview question. Let's move on to nursing interview tip number 2, and that's to showcase your clinical skills and your experience. This is so important. Make sure you detail your experience. So be ready to discuss your previous work experience, including specific duties, responsibilities, and any special projects or achievements. Also highlight your key skills. So focus on essential nursing skills such as patient care, medication administration, patient education, and emergency response. And I recommend you use the STAR method. So when answering any behavioural interview questions, use the STAR method: situation, task, action, and result. This method is designed to provide you a structured and detailed response to their interview question. So let's take a look at an example behavioural interview question that comes up very commonly during nursing interviews. Can you describe a time when you had to handle a difficult patient? Here's my top scoring answer for you. In my previous role at a busy hospital, I encountered a patient who was extremely anxious and resistant to treatment after being diagnosed with a chronic illness. My task was to ensure the patient received the necessary care while addressing their anxiety and resistance. I took the time to sit with the patient, listen to their concerns, and provide clear, empathetic explanations about their condition and the treatment plan. I collaborated with the healthcare team to adjust the approach to care, ensuring the patient felt more in control and supported. Additionally, I involved the patient's family to create a supportive environment. The patient gradually became more cooperative and engaged in their treatment. Their anxiety levels decreased significantly, and they adhered to the prescribed care plan, leading to improved healthcare outcomes. This experience reinforced the importance of empathy, communication, and individualized care in nursing. Okay, my tip number 3 for nursing interviews is to demonstrate your soft skills. So communication skills is a great one. Show your ability to communicate effectively with patients, families, and colleagues. And when you do that, make sure you provide examples of where you've successfully managed communication in challenging situations. We'll come back to that in just a moment. Another soft skill to demonstrate is empathy and compassion. That's really important. Make sure you highlight your ability to provide compassionate care and support to patients. So you can share stories where your empathy made a significant difference. For example, teamwork is another soft skill you must demonstrate because nurses often work in teams. So emphasize your ability to collaborate and support your colleagues. You can discuss instances, for example, where teamwork led to better patient outcomes. And finally, problem solving. So nursing often requires quick thinking and problem solving. So be prepared to discuss how you handle unexpected situations or emergencies. Let's go back to the soft skill of communication skills and take a look at a top scoring answer to the interview question. Can you provide an example of how you effectively communicated with a patient to improve their care? Now, this is a common nursing interview question which I'm seeing come up time and time again. So let's take a look at my top scoring answer. In a previous position, I encountered a patient who was non-compliant with their medication regime due to a language barrier. I quickly recognized the importance of clear communication and arranged for a medical interpreter to assist us. By actively listening to the patient's concerns through the interpreter, I was able to explain the treatment plan in a way that they understood and addressed their fears. This approach not only improved their adherence to the medication, but also built trust and rapport. This experience taught me that effective communication is crucial in nursing, as it directly impacts patient outcomes and their overall experience in the healthcare setting. Okay, nursing interview tip number 4 is professionalism and attitude. Make sure you demonstrate both very, very well. So what I mean by that is dress appropriately. Wear professional attire that is appropriate for the healthcare setting. First impressions matter, and dressing professionally shows respect for the interview process. I recommend you wear a suit. Dress formal. Punctuality. Arrive on time or a few minutes early for the interview, ideally 5 to 10 minutes before your interview start time. Being punctual demonstrates your reliability and time management skills. Positive attitude. Make sure you maintain a positive and enthusiastic attitude throughout the interview. Show your passion for nursing and your eagerness to contribute to the team. Don't forget to smile. And that leads me on to body language. Pay attention to your body language. Maintain eye contact, offer a firm handshake, and sit upright in the interview chair, and only sit down in that interview chair when invited to do so. Make sure you demonstrate positive body language because it can convey confidence and professionalism. And finally, nursing interview tip number 5 is to follow up after the interview. So make sure you send a thank you note after the interview. If easy to do so, you can do a handwritten note, but I recommend generally that you send a thank you email to express your appreciation for the opportunity. You can mention something specific from the interview to personalize your message, and then after you've done that, make sure you reflect on the interview. This is a really important tip. Take some time to reflect on what went well and what you could improve on for future interviews. It's a learning experience, and it's not the be-all or end-all if you don't get the job. And even if you do, what did you do well that you can carry on into further job interviews in the future? And make sure you stay connected. If you don't hear back immediately, it's okay to follow up with a polite email inquiring about the status of your application. This shows your continued interest in the position. So let me give you a brilliant template that you can write down for a follow-up or thank you email to send after your job interview. And after this, I'm going to give you my 30 nursing interview questions and top scoring answers that you can download right away. So let's take a look at that template. The subject of the email should be, "Thank you for the opportunity." Dear, and then insert the interviewer's name. I wanted to extend my sincere gratitude for the opportunity to interview for the nursing position at, and then insert the hospital or clinic name yesterday. It was a pleasure to learn more about your dedicated team and the compassionate care you provide. Our conversation reinforced my enthusiasm for joining your organization and contributing to your mission. I am particularly excited about the innovative patient care initiatives you mentioned, and I'm confident that my skills and passion for nursing align well with your needs. Thank you again for considering my application. I look forward to the possibility of contributing to your team and making a positive impact on patient care. Best regards, and then insert your full name, your phone number, and your email address. Now, if you want to get the edge over other candidates, you can download my top 30 nurse interview questions and answers in a PDF guide right now by clicking that link in the top right-hand corner. I recommend you do this for 2 reasons. The first reason is it will take you through to my website, howtobecome.com, where you can get all of the answers we covered in this tutorial, plus a total of 30 brilliant responses to nurse interview questions suitable for all healthcare organizations worldwide. And secondly, the next reason is I've given you plenty more interview tips and advice on that page to give you the edge in your interview. It's a brilliant resource guaranteed to help you prepare effectively for your interview and also, more importantly, put you ahead of the competition. Make sure you check out that link. I hope you've enjoyed this tutorial. Please don't forget to subscribe, as I'm on a mission to help as many people as possible pass their job interviews, and I can only do that if you are subscribed. Please also hit that like button, as that encourages me to make more videos just like these. And if you have any questions regarding any specific nursing role or healthcare organization, do let me know the name of that role or healthcare organization in the comment section below this video, as I respond to every person who leaves a comment on my channel, and I'll get back to you with even more interview tips and advice. And finally, don't forget to connect with me on LinkedIn. I've put my LinkedIn link in the description below. It's always great to connect with like-minded professionals such as yourself. Thank you so much for watching. I wish you all the best with your interview. Have a brilliant day.